Hi, I'm Dr. Douglas Stoddard. This is the SEMI Minute. Today we're talking about the recent Health Canada decision to cancel the stem cell programs in Canada at various physicians' offices. These were being used mostly for musculoskeletal indications. Things like osteoarthritis, tendon tears were really the top two. Certainly in our office they were. And after about a decade of using these procedures, Health Canada last May, that's May of 2019, decided for various reasons that these procedures should be put on hold until further work is done on the topic. Turns out that these procedures really don't easily fit into the pre-existing frameworks that Health Canada has for approving various procedures in Canada. And accordingly, until these rules are sorted out and policies are sorted out, it was decided at the level of Health Canada to put these things on hold. It was an unfortunate decision. The physicians working in this space, including myself, really felt that these procedures were safe, very effective, a wide international body of research proving that these procedures do work with patients and these problems. And above all, most importantly, these procedures are safe. Very few incidents of complications with procedures like this. Mostly we're dealing with an infection risk. Simply based on putting a needle in the body, there's an infection risk of approximately 1 in 10,000. That was really the only risk we ever saw with these particular procedures. We're talking about stem cells harvested or purchased from different locations. We harvest stem cells in people from fat stores, which is called an adipose-derived stem cell procedure, or bone marrow, which is called a bone marrow aspirate procedure. These are the two most common bedside or procedures done at the bedside. You can also purchase stem cells from various stem cell banks, fetal stem cells, amniotic sources of stem cells, etc. But these are purchased. Nonetheless, I really always used adipose as a bedside technique, and it was very safe, very effective in arthritis and tendinopathies and tendon tears. But until we get a new framework with Health Canada in terms of how to look at these procedures and approve them, we're temporarily on hold. Unfortunately, no one really knows when we'll be allowed to do them again. It could be a number of years, but in the end, meetings have begun with stakeholders in Canada. First one is actually scheduled for this spring 2020. And once we attend these meetings and get this ball rolling, we'll be in a much better position to know how long it could be before we see these procedures approved again. Meantime, Canadians, not to be sort of discouraged, are still traveling to get these procedures done. They're going to the US, they're going to Panama, they're going to Mexico, and other countries in the world that still offer these procedures. And so in the end, our hope is that at some point, sooner rather than later, we once again can keep Canadians in Canada getting these procedures and ultimately helping conditions that previously really only had surgical alternatives. By the time a patient would come to see me to discuss these procedures, they really have had tried a variety of interventions for their pain: therapy, orthotics, bracing, various drugs such as anti-inflammatories and narcotic meds like Tylenol-3. These are patients that really are at their wits' end and contemplating a surgical procedure such as a joint replacement or tendon surgery, and that's where these procedures fit into the spectrum of medical care. They really come between the therapists and the more conservative care and the surgeons on the other end of the continuum. And thankfully, we were able to avoid surgery with many patients with using these procedures, whereas again before we really didn't have a lot of choice to offer them. So hopefully we'll have an update after spring of 2020 in order to first see where Health Canada sits after we start these meetings. Thank you and see you soon.